There are 49 new confirmed cases of COVID-19 and 20 new probable cases to report today. There have been no additional COVID-19 related deaths. So the overall number of new cases is 71 and the new total in New Zealand is 868 cases. There are now 103 reported cases that we can confirm have recovered. Today we have 13 people in hospital around the country, including one person in ICU. All those people are in a stable condition. From our lab testing numbers, we can report a 7-day rolling average of tests at just over 2,000 per day, and the total number of lab tests to date is 29,485. And a high of 3,446 tests were processed yesterday. We now have the capacity to do over 5,400 tests each day in New Zealand. For the cases that we have information on, there's still that strong link to overseas travel, although it's just dipped below 50%, it's at 49%, as well as 33% who have links to confirmed cases. So far, we have confirmed community transmission in just 1% of cases, but there is that 17% of cases that are still under investigation, and we would expect many of those to end up being confirmed as community transmission. An update on the clusters. We now have 10 significant clusters, that is more than 10 people who are infected from a single point source, and those are in Napier, Wellington, Hamilton, Auckland, Bluff, Matamata and Waitakere. The three biggest are the clusters in the Marist School in Auckland, that's 59, the Bluff cluster, which involves 53 people, and the Matamata cluster of 49 people. A quick update on community-based assessment centres. Those have been operating in some locations for the last couple of weeks, and we now have 62 in place around the country, as well as 45 designated practices or swabbing centres set up to handle testing for COVID-19. We've asked all DHBs to set up and start running their CBACs, as they're called, from this weekend, so we know where demand is strongest, and also so that we can just test the processes that those CBACs are running well, and they've got the testing happening and getting the swabs through to the labs nice and efficiently. Just a little on recovered cases, and I was asked yesterday about the definition. Just to clarify our current definition. So I've had a look at this since yesterday's conference, and actually countries are taking slightly different approaches to this, not unexpectedly, given this is a novel disease. But those approaches are based on what is generally done for other similar communicable diseases. We're continuing to watch international developments closely, and we're very much in line with Australia and many other countries here. So the current criteria we are using for someone being confirmed as having recovered and being able to be released from isolation is that it is at least 10 days since the onset of their symptoms and at least 48 hours from being symptom-free. That's the advice we have currently from our communicable disease and specialists, and we'll keep that under close watch. In fact, the technical advisory group is meeting again today, and we'll be reviewing that. So a negative test is not required for someone who is recovering at home from COVID-19 infection, which would generally be mild to moderate, and for someone who's been hospitalised, it's up to the clinician whether they choose to do testing prior to discharge. In terms of the border, just an update on what's happening there. So yesterday, 300 people arrived into New Zealand, so you can see that the numbers are now much, much lower than they were even a few days ago. Those are all Kiwis coming in. There are no visitors coming in, so these are Kiwis returning to New Zealand. All people entering New Zealand are required to self-isolate for 14 days, every person coming in has to fill out a comprehensive set of questions, and we'll put those up, a link to those on our website. That is the back of the new arrival card, with quite a significant number of questions about possible exposure to COVID-19, any symptoms, whether they have been tested, and so on. That happens on arrival. They're disembarked in small groups to be processed so that there's not a big crowd of people there. The health officials at the gate, or when they're disembarked, talk about their plans for self-isolation. If people are symptomatic, then they are assessed and temperature taken, and they are quarantined and tested. And at the moment we have 135 people in quarantine. Those who don't have plans that satisfy the officials there for self-isolation are then put into managed accommodation, and we have 1,405 people in that managed isolation at the moment. If someone does have a good plan, then they are required to go into self-isolation according to that plan, to travel to their home and to do that. Just a word then on primary care. Yesterday the Minister announced funding for primary care, including both general practice and pharmacy in the community, and I just want to acknowledge the frontline role of our primary care practitioners, both in general practice, those who are working in CBACs, and of course our pharmacists as well. They are playing a key role in both assessing and identifying and testing people for COVID-19. So the announcement by the Minister yesterday was for $30 million, of which $15 million is going into general practice and $15 million into pharmacy. So just to give you a feel for what that means for general practices, a general practice with about 5,000 people registered would receive around $12,000 as an upfront payment. If it was a high needs practice, that would be $22,000. In addition, practices are eligible for the wage subsidy scheme, and we are doing further urgent work on funding for primary care for general practice to ensure they are financially sustainable, and that we will be providing advice to ministers in coming days. So just again to acknowledge the role of primary care, a significant role there. They are working at the front line while our hospitals prepare. At the moment we have a small number of people who are or have been hospitalised, so most of that care is happening out in the community. And finally, I just want to finish with today some information in today's WHO situation report update, which has got a very good summary of the current evidence around transmission of COVID-19. And just a few of the excerpts from that, and we will put a link to this on our website as well. So first of all, symptomatic transmission. So the data from the published epidemiological and virological studies provide evidence that COVID-19 is clearly primarily transmitted from symptomatic people to others who are in close contact via respiratory droplets, by direct contact with each other, or by contact with contaminated objects and surfaces. It seems that people are most infectious early on in the infection, that may be before or just as they are developing symptoms, and for the first 2 or 3 days. The average time before people develop symptoms after they have come in contact with the virus is around 5 to 6 days. There's been a lot of speculation and some studies published around pre-symptomatic transmission. As I say, the average time between being exposed to and developing symptoms is 5 to 6 days. And during the period when people are pre-symptomatic, some infected people can be contagious. However, that transmission occurs through the same routes as it does if people are symptomatic. That is through direct contact with people and droplet exposure, or those droplets then being passed on to other objects and people being infected through that route. So it may be that people are infectious for 1 to 3 days before they develop symptoms. As I say, and it says here, the WHO say, it's important to recognise that pre-symptomatic transmission still requires the virus to be spread via infectious droplets or through touching contaminated surfaces. And finally, asymptomatic transmission. So an asymptomatic laboratory-confirmed case is a person who's confirmed to have COVID-19 but who did not or does not develop any symptoms. There are very few reports of laboratory-confirmed cases of people who are truly asymptomatic, and to date, there are no documented cases of asymptomatic transmission. This does not exclude the possibility it may occur, and some asymptomatic cases have been reported as part of contact tracing in some countries. The important thing here is that whatever the transmission, whether it's symptomatic, pre-symptomatic, or indeed, if possible, asymptomatic, the same precautions will protect people. That is, physical distancing, not going out if you are unwell and putting others at risk, cough and sneeze etiquette, and very importantly, meticulous hand hygiene. Thank you very much. I'll hand over to Sarah.
Thank you. Today I thought it would be useful to explain how we're providing support to older New Zealanders. Since the 23rd of March, about 500,000 New Zealanders aged over 70 years have been in self-isolation along with the rest of us. Many of these people will have the support from family, friends and neighbours nearby, but some won't. Some older New Zealanders may not have access to the internet, may not be aware of the help that's available to them at this time. From the 30th of March, check-in calls started as part of a response supported by the Ministry of Social Development Regional Commissioners. They're coordinating through their local networks to make these check-in calls. We also know that people from community organisations and volunteers from senior networks are also providing support. The calls are starting with a smaller group of older New Zealanders who may not be receiving information on where to get the help that they need. Many people contacted so far have reported that they appreciated the call, and that the large majority also reported that they already had all the support that they needed and were coping well. Referrals for service are being made, and in some cases where people have asked, follow-up calls are being scheduled. The network of calls to check in on people will widen to include other older people with high needs. Also, an email has been sent to 324,000 seniors, assuring them that their payments would continue as usual and ensuring they knew that their winter energy payment would be doubled for this year. The Super Senior newsletter, a special COVID-19 edition, has also gone out to this group, full of information to support their health and well-being, point them to where they can get help and information, and to assure them that they're not in this situation alone. If concerns are raised, they are being referred to the local Civil Defence Emergency Management Group to provide assistance. I'd like to thank all our network partners for each playing their part in helping us look after some of our most vulnerable citizens, and also encourage people to look out for their older neighbours living next door, to check in with them, make sure that via phone or text messages to see if they're okay. I just want to talk about volunteering. We've received many offers of community assistance from volunteer groups right across the country, and I'd like to thank you so much for stepping forward and being so willing to help. A work stream has been established to provide national coordination and information. It will tap into existing groups and their processes and networks. More information will be available soon, but in the meantime, we just ask those who are willing to be able to stay at home and stay safe, and we'll come out with more information as soon as we can. The last item I'd like to cover is around the National Action Plan issued from the National Crisis Management Centre. These are standard documents produced in emergency responses that describe how response objectives will be achieved. These are not secret documents, and they are distributed widely across agencies involved in the response. There shouldn't be anything in this document that should surprise people. We've been open about what we're trying to achieve with the national response. The objectives and tasks in the action plan give effect to the COVID-19 Alert Level 4. They set out what our overall mission is, what our objectives are, and the high-level approach and tasks that will be undertaken to achieve those objectives. Having an action plan ensures that everyone involved with response is on the same page and is clear about what they need to do. The National Action Plan number 2 for the COVID-19 response also had attached to it the National Action Plan number 1 as a summary, was sent out on Wednesday. It focused on the Level 4 alert, replacing that number 1 version of the National Action Plan that outlined initial actions before the alert level was raised. The term eliminate in the document referred to the alert level 4, eliminate. This is a COVID-19 suppression strategy that aims to ensure that the health system capacity is not exceeded by preventing widespread outbreaks. The National Action Plan will be published on the COVID-19 website today. And finally, as we head into our second weekend in lockdown, I can't reiterate enough the importance of staying home to save lives. We're all in this together. Do get outdoors for some fresh air and exercise, but stay local. Travel should be restricted to those essential travel and for people to buy food or medical supplies. Thank you to everyone for everything you're doing to make sure that we're able to unite against COVID-19.